So I'd like to thank you all for joining me today as we're going to talk about navigating the healthcare system to advocate for yourself and for your loved ones. Today during the presentation, I'm going to briefly introduce myself and talk a little bit about my experiences and my background. We're going to delve into what is advocacy, choosing a provider, the importance of communication and how you can go about doing that, when to be flexible and when to hold your ground, how you can be prepared so that you can get the most out of your appointments, the things that you're going to want to think about and consider with the check-in process during the exam, and then asking for resources, and finally talking about knowing your rights and where you can be a little more firm when you're advocating for yourself. So first of all, I want to share with you, I get asked often, what do I know about healthcare and advocacy, and why am I passionate about talking about this? So first off, I have a PhD in health education and health promotion that I dare to say I'm heading soon into my 20-year reunion of that graduation. So it feels like it just was yesterday, but yet it's not. I graduated from the University of Alabama in their program. Also in my work experience, I have worked with a variety of different medical conditions. I was a professor, but I also have worked with folks who are living with Alzheimer's. I've worked with folks in the cardiac rehabilitation space, individuals who have strokes. I've worked with injured athletes. Right now, I currently work for the National Hemophilia Foundation. And so I'm helping individuals who are living with inherited bleeding disorders. And then I volunteered in a variety of spaces, including the IBD community, as well as some other groups that have different medical conditions. But foremost, I feel that my experience in the space of advocacy comes from my personal lived experience. I am both a caregiver and a patient. Unfortunately, between myself, my parents, and my children, I think we have covered just about every medical condition out there. I have airplanes on my presentation because I often say that I feel like if there were frequent flyer miles for the Children's Hospital, I would have been able to travel around the world by now. So unfortunately, I have a lot of lived experience in a variety of medical conditions, and also in a variety of situations, whether that be something that comes up that's emergent, to chronic illnesses, to genetic conditions, inherited conditions, and then things that develop later in life. So I feel like I cover everything from emergent to acute to chronic in my lifespan. So I have had a lot of experience with healthcare, and there have been a couple of years where we've had, just for my two children, over 100 medical appointments in 1 year. So this is a space I'm pretty familiar with. So next I want to talk about the idea of being an advocate versus being a navigator. So to advocate for something is to support or to recommend it. And so when people talk about advocacy, I tell them, to think about it like the concept of lobbying. So when you hear about lobbyists in your state capital or in Washington, D.C., those are people who have a passion project that they are putting their voice behind, and they're sharing information and resources with decision makers to try to get those decision makers to share that same passion and belief and to take action on that. So when you're being a patient advocate, that is what you're doing, is you are lending your voice to a situation that needs action, and you're asking for action from someone else. So in the space of healthcare, that would be asking for a healthcare provider, or it may be asking for an insurance company to support your situations. Also could be an institution. Maybe you're asking for help from the Crohn's and Colitis Foundation. Maybe you're asking for help from a different nonprofit organization to support you. So your job as an advocate is to lend that voice. The biggest thing that I tell people when you're doing that is the passion piece. So making sure that you are doing so professionally and you're doing so gently, because we can get really passionate in this world with that we're living in with health conditions. And when it's impacting your own personal health or the health of someone you love, it is very easy to let the emotions get raw. And so you're going to have the best success if you approach it like you're a lobbyist and like you're going into Washington, D.C., and you are sharing this information as a business person instead of as your own raw emotional story. People will respond better if you can keep that emotion out of it. A navigator is going to be someone who moves things along or directs the route. So a lot of times you're starting to see more hospitals that are having what they call a patient navigator role. And the patient navigator could be someone who helps with scheduling. Maybe there's someone who, once a family receives a diagnosis, they help move you down the pathways from diagnosis to treatment. So scheduling all the blood draws and the scans and those things, and then scheduling all the follow-up appointments. Maybe you're going to see, in this world of IBD, you're going to see a nutritionist, a dietitian, and then you're going to see a social worker who's going to help you figure out things with your insurance. And maybe they'll have you connect in with a skilled nurse educator who's going to provide you deeper education about the different dietary choices and lifestyle choices, and then the different medicines. So, that process of moving from diagnosis to treatment, if it's in a great center that has a full comprehensive care team, often does need a navigator to help coordinate all those appointments and connect you into the right people. The navigator can also help move a person through the process of scheduling procedures, understanding the pre-treatment information. So for example, my son has some imaging things coming up soon, and the first set of information that we got from the provider's office was incorrect on the preparatory piece, and thankfully I've done this procedure multiple times. So I called and double checked, and that something got lost in translation at the pharmacist and they had the wrong information there. But if I didn't know, I would have picked up the medicine and moved forward with that process until I got my prep call from the nurse, and we all would have realized that something was missing. So that navigator can help connect those pieces for procedure preparations also. Sometimes the navigator will support people with billing. As I'm sure many of you experienced before, getting new treatments through insurance can be very challenging, where you're going to have to write an impassioned letter, get a healthcare provider to write an impassioned letter, show a use case or reason why this is going to be important. I can tell you for my own family member who has Crohn's disease, we have had to write some pretty significant letters to our insurance, which we have lovely insurance, but they still sometimes have denied different things that have come through. And we've had to, basically explain the cost of what would happen if we don't get to move forward and he ends up in the hospital for 5, 6 different times over the period of a couple of months, which has happened before, and the cost of that versus what they're looking at. So that navigation can be really important for that billing process. And then finally for home care. So, when you are going home from a physician's visit or being released from a hospital from a stay, what are going to be the expectations for what needs to happen at home, and what type of resources do you need? Are you going to be on an enteral feeding for a while? Are you going to have tube feeding? Are you going to need supports in the home as far as a lift in the restroom to adjust the height of the toilet seat? Are you going to need a walker, a wheelchair? Are there going to be temporary or permanent things that are going to need to be done? And this person can help coordinate that, all the way down to helping you figure out getting a construction person to come into your home and install a lift up your stairs. I know someone who had to do that recently. They realized it was just becoming too challenging for their loved one to get upstairs, but they didn't want to move their bedroom. So that process of navigator can be so much more than just what people initially think of. It can cover all of these different areas. And so you can be this for yourself or for a loved one also. It doesn't just have to be the hospital. The thing is learning yourself the steps to move through this so that you can be successful with making each of those things happen on your own. So I like to say the idea again of this advocate is using your voice to explain what is needed. The patient navigator is using your skills to move someone through the process, and they often go hand in hand. So you are going to have to use your voice to explain what do you need? Why do you need it? Why is it important? And why is it time sensitive? And you're going to use your cool intellect and your ability to do time management and negotiation to help move yourself through that process. So thinking things through about, what types of things can you coordinate together? Can you bundle appointments at the same time? If they schedule a scan for the one day and they try to schedule the follow-up appointment for the provider the same day, is that appropriate? Can the results get back in time? Or does there need to be a couple of days? Oftentimes you're having totally separate facilities scheduling those two appointments, and you yourself have to be aware whether or not it's appropriate to do them on top of each other. Or is it appropriate to have your blood draw 3 weeks before the appointment, or is it information going to be null? So that navigation piece is helping to move yourself through this process and really becoming informed about how your healthcare provider's office works, how your insurance works, and how you can best get what you need out of that process. So one of the things that I think is really important to advocacy that a lot of people don't talk about is choosing the provider and making sure that they're a fit for you and that you have the right provider system or network. So one of the important things that I think every person should have is a primary care provider that you really connect well with. And this person is kind of the ringleader of all of your care. Their job is to do the day-to-day components, so when you have the sniffles or you get a rash or the normal day-to-day healthcare thing, but they also are the ringleader or the orchestrator, if you will, of all of your specialists. And so they help connect you if you have a symptom that they aren't sure what that is, and it's definitely not just an acute thing that's easily treatable. They're going to do a referral to a specialist. They also are going to be responsible for the day-to-day management of what that specialist sends back for you. So, for example, a person with diabetes will have a team that's caring for them, but they also will have check-ins with their primary care physician periodically about that. So one of the really important things when choosing a primary care physician is making sure that you have someone that is going to refer you readily to a specialist and does not have an ego situation where they feel like they're the only ones who should be or can be solving your problems. And, I like to say we love that our pediatrician is amazing at knowing when to phone a friend. And, sometimes you'll be in for just a regular appointment and she'll get on the phone and call the children's hospital and say, this is what I'm seeing. Here's a picture. Here's this. What do you think we should do? So making sure that you pick someone who is really willing to connect into those resources and not try to make decisions that are outside of their specialty. The other piece of that, though, is also making sure your specialist or your primary care provider is not afraid of you or your medical condition. And we have experienced that before also, where there will be providers who will read my chart or my children's charts and say, just go to the children's hospital or just go to to your specialist, because they are nervous, even though, let's say you're coming in with a rash. We experienced this recently, where you're coming in with a rash for a kiddo and, it doesn't have anything to do with, some sort of big Crohn's flare, but they still were really anxious to even just see because of all the other conditions. So you always want to pick a primary care provider who is going to be comfortable treating you, comfortable connecting with a specialist, and hopefully that has partners who will be also. This was a situation where we had to see a partner because our provider was not available and the partner was a little more nervous about my kids. So making sure, if you can, that they have a network of people who will support you also. Another thing when choosing a provider is urgent care. A lot of people are not aware that there are different urgent care choices. And I'm not talking just the emergency room, but when you have a situation where you can't get into your primary care provider and you need quick treatment, maybe you get bit by a dog on your hand, or you injure your foot doing yard work, whatever that is, you want to be sure that you're going to an urgent care facility that has the expertise in their staff to deal with your other situations as well. So, and understanding that there are often multiple urgent cares within a facility, depending on the size of the town that you live in, and or that it may be worth it to go to a nearby town. So, for example, again, recently we had a situation in our family where we needed to access urgent care. The primary care's office was already booked for the day. But our local urgent care in the town I live in, there were 3 different facilities and they were all at over a 2-hour wait. And so I contacted the urgent care for the same facility office in the town 30 minutes south of us, and they had a 10-minute wait. So it was definitely worth it and safe for me to be able to drive the 30 minutes of the situation going on and get care much more quickly. So just knowing about what's available in your community, who works in that urgent care, is it a physician assistant, a nurse practitioner, an MD, a DO, who is doing the care, what is their credentials, so that you know where is going to be the best place to go. So again, for example, if I went a little further, I could have accessed an urgent care at the children's hospital, which would have been an even better option, but I didn't need it this time, so I didn't go the extra drive. But that it's nice to know what's available close to you and then further out so you can assess where's going to be the best place to go. And then finally, choosing a care team. And so you have all these auxiliary people in addition to your primary care provider and your specialist. And those would be, again, the physical therapist, the social worker, the dietitian, maybe it's if you work with a chiropractor, your dentist. Those are going to all be part of a care team that helps support and build the work that you're doing with your, whether it's Crohn's or ulcerative colitis or other medical conditions. Those are the people who you want to make sure wrap around you and provide you all that care. And unfortunately, a lot of people are not building out a care team and building consistency with providers. And it really is great if you can connect in and get consistency with the same providers so that you can go back and ask questions and build that rapport. So again, with inflammatory bowel disease, the dietitian can be a really key part of that if you are implementing the specific carbohydrate diet and having some struggles with figuring some things out or having someone you want to ask questions to and it's hard to get into your specialist. If you have access to a dietitian who specializes in the diet or understands the diet, that can be really helpful and help you advocate for yourself for what you need and what types of maybe blood tests you need to do based on the symptoms you're feeling to see if there's any deficiencies, or how even they may help you get back into your specialist sooner by being able to do a referral and calling in and them as a medical provider or healthcare provider explaining why you need to be seen more emergently than maybe the 9-month wait that is currently happening. So a good resource I like to tell people is docinfo.org. It's on the screen there, docinfo.org. Instead of using Healthgrades or some of the other sites that are available, I really do recommend DocInfo to look up a provider and check out their background information when you are trying to decide if it's someone you want to visit. You can find out where they're licensed, if they have any malpractice cases, what are their specialties and certifications? Are they board certified? Are they board certified in multiple things? It's a really great resource. And that information that comes into DocInfo comes from the state and federal licensing boards and organizations versus Healthgrades and some of the other organizations have good information, but you aren't able to necessarily have a full factual picture because individuals can write in on those as opposed to you being able to get something just directly from the source. All right, next types of providers, knowing the little bit of difference about the different types of physicians or advanced care providers that you can access. Also, there's going to be MDs, DOs, and NPs that you're often going to be seeing in the physician's offices when you call and request an appointment. And an MD is going to be someone who went to conventional medical school. They're going to do a disease-specific approach. So, you're going to see your gastroenterologist to talk about your Crohn's disease, typically. A doctor of osteopathic medicine attended an osteopathic medical school. A primary difference between an MD and a DO is the training for osteopathic medicine includes hands-on treatment often, such as a massage or a spinal manipulation or showing someone some additional stretches or exercises to go through in addition to the disease-specific approach. The other thing, I have lots of friends who are MDs and DOs, and my friends who are DOs will tell you that they tend to do a little closer to like a functional medicine approach where they're going to ask a lot of questions about the rest of your body and other things that are going on that may not necessarily seem obvious to be related to the disease-specific approach that you're walking in. So if you have, Crohn's disease and you're coming in because you think you might be experiencing a flare and you're having stomach pain, or maybe you're having constipation, a DO might ask you more questions about your joints and if you've had rashes or headaches or eye pain or things that then a disease-specific MD provider might ask, dependent on time that they have available, just because the DO approach tells them to start with a full body approach and focus in, versus that MD approach usually starts in and then looks out as they need to. So your MD might also ask, but they're probably going to zone in on that Crohn's symptoms first, and then ask if there's been any other things you've been experiencing that go together. So there's just a little bit of a difference there, but the important thing is to know that both groups have to attend a residency and both pass the same licensing exams. So it's just two different pathways for different types of medical schools in the United States. Also, you may be offered to see an advanced nurse practitioner when you go to the doctor, or when you call to ask for an appointment. A primary difference, again, knowing lots of nurse practitioners as well, is a nurse practitioner tends to be a little bit more patient focused than disease focused. So they are going to be doing a lot of the patient education in a provider's office. And they also may be the first person you see. So you might be offered an appointment, so you call in and they say, Dr. So-and-so can see you in 11 months, but their nurse practitioner can see you in 3 weeks. And so that nurse practitioner is oftentimes the first gatekeeper. And so also a very qualified person, they can write a prescription, they can help care for you, and they will often do that intake of helping assess what are your symptoms, and where can they make an impact? Are there psychosocial components that they need to connect you to additional resources with social work or with mental health? Are there lifestyle components that can be done? Do they need to connect you with physical therapy or with the dietitian? And then is there preliminary testing that needs to be done? Are there blood tests, imaging, scans, those sorts of things? So sometimes providers' offices will use the nurse practitioner as sort of that gatekeeper to get all that preliminary work done, so that when you get to the MD, if you get transferred to the MD for care, they can really hone in and specialize on those specific details that they felt needed someone with a little bit more advanced training to really focus on. So the biggest thing that I would recommend to people is to think about that there can be a different best fit for different situations. So again, if I call in and, someone in my family has experienced something that's emergent and I feel it very strongly needs to be seen by the specialist because it may end up needing to have advanced care, possibly a surgery, that sort of thing, then I may say, is there any chance to see the MD? Versus if I feel like I'm going to have to wait too long to see that MD, and I know the nurse practitioner and I know that they do a lovely job and that he or she is a great advocate for the patient, then I may ask for them first and have them help be that navigator to move us through that process of screening and testing and blood draws and all of those things, so we can gather that packet of information and then have it given over to the MD. The other pieces in this in choosing a provider is the different types of medicine. So we have in America, typically conventional medicine, and then we have functional medicine. And then there's also the worlds of naturopathic medicine and Eastern medicine. For the sake of this conversation, I'm just going to quickly talk about these two, conventional and functional. So conventional medicine is in the United States is done in this kind of concept of silos of single disease specialties. If you think about when you call a hospital or you look at their website, they're going to have a gastroenterology unit. They're going to have a hematology unit. They're going to have a urology or nephrology unit. So they're going to have these different silos of these disease specialties. The people who work in the conventional medicine system are trained to identify symptoms, name a condition, and then treat those symptoms or condition. So if you are thinking of this in the space of inflammatory bowel disease, the primary goal in a conventional medicine pathway, again, not all providers work this way, but The typical pathway is to identify if there is inflammation and then suppress the inflammation. And there's lots of different ways that different providers can choose to get there, but that is that primary path, is figure out if there is inflammation and then get the inflammation to stop. Functional medicine is this kind of newer pathway that I think of as the bridge between conventional medicine and naturopathic medicine, where you're starting to see a lot more MDs and DOs existing in that functional medicine space, where they're wanting to look at a whole systems approach and trying to identify what is missing. And so instead of just identifying the symptoms, naming the condition and treating it, they're going to ask the question of, why is there inflammation in the first place? What's causing the inflammation? So this would be a great example of where the specific carbohydrate diet fits in. Like, is there something that we're missing? Is there a food? Is there a stressor in the person's life? Is there something that's causing this inflammatory pathway to present, as opposed to just, if I give you this medicine or if you eat this diet, it fixed it, good job. They want to figure out what was happening in the first place that was causing the pathway to exist. So the functional medicine approach will often involve genetics, nutritional changes. The biggest thing for people to know is that the functional medicine process is very slow and it needs a high level of patient engagement. So as you know, if you're on the specific carbohydrate diet, it doesn't just fix it the next morning. You don't start it on a Friday night and Saturday morning you wake up and you're cured. It's a process that you have to go through, and it's an ongoing process. When people choose to come off of the diet or challenge foods, sometimes those challenges don't work well. I can tell you, my son has challenged some food under the supervision of his healthcare provider. And one time when he added something in, he added in cocoa powder, it didn't go well. And then a few years later, he tried it again, and he's been able to use cocoa powder ever since, which broadened some of the foods that he could eat. So it's that really slow working through things, coming back to it, having that really great relationship with the provider is really important. So thinking of this in terms of a tree, I like to think of it as the conventional medicine MD approach is going to be the leaves, looking at that specific component of the tree, figuring out what is going on with it and addressing it. The DO approach is going to be looking at the branches that lead to the tree, to the leaves. And so seeing if there's anything going along in the process that might be influencing what's happening to the leaves on the end. And then the functional medicine approach is going to be looking down into the roots and seeing what's coming from the bottom up, what's happening with nutrients, with water, with the soil conditions, with the sunlight, thinking of it in terms of a tree. So thinking of it in terms of yourself as a person, what's going on with your genetics? What's going on with your environment? Are you living in a space that's stressful, that's high levels of pollutants, that has low availability or access to physical activity? Do you have lack of sunlight? Are you having vitamin D issues? Now, the biggest thing to remember is that any provider can be an MD, a DO, any type of those can be a functional medicine provider, and some of them aren't even necessarily identified specifically that way. But I know this probably seems like, why am I going into this? But I think it's really important for people to figure out what level of input you want to have into your healthcare for yourself or the person you're caregiving for, and then choose a pathway and a provider appropriately. Because one of the most frustrating things that can happen is if you are given recommendations for treatments to do, maybe say from a provider who's in a functional medicine space or who works that way, and they say, I want you to go home and do this, and it's not really feasible with your lifestyle. Maybe you can't afford it, you don't have the time, you don't have the tools, you don't have the resources, then you're not going to progress in your healthcare. And so you have to be able to communicate that with the person. Or maybe you are seeing a conventional medicine provider who does not believe in diet, and yet that's the primary way you're trying to treat your Crohn's disease. That's not a good match. You don't want to have to work against your provider, you want to work with your provider. So making sure you're having people who understand your goals, understand your capabilities, and are going to support you in that care is really, really important. So the next step in this whole process is communicating. So when you know what you need to be able to share that with other people. And that's that patient advocacy voice part of using your voice. So one, knowing your symptoms. I can't tell you how key it is to be able to quickly translate that information over, not only when you're going to see the provider, but when you're calling in on the telephone. So when you call in, you need to be able to give the nurse or the person who's answering the phone a quick one sentence synopsis of how emergent your situation is based on your symptoms. So, I'm experiencing belly pain. Okay, they get calls with a lot of people that have that. I'm experiencing belly pain. That's a 7 out of 10. I've had difficulty sleeping the last 3 nights. That tells them, oh, this is a more serious situation. Or I'm experiencing loose stools or frequent stools. You want to give them more information than that. How often, how big of a problem is it? Are you having difficulty maintaining fluids? So that they understand what they might need to do and who they might need to refer you to. They might say, oh, well, you need to just go to the emergency room, or you need to go to urgent care, or gosh, again, the MD is booked, but I can get you in with a nurse practitioner today who can talk to you right away, and then we can go from there. So know your symptoms, and then identifying your concerns. Figure out before you go in to see the healthcare provider what you want to talk about. So I actually created for my family, and then have passed along to people that I do patient advocacy work with for their families. I built out a sheet. And so I have on there, what are the symptoms we've been experiencing, and what are our questions, and what are our treatment goals? And so when we go into an appointment, we know ahead of time what questions we're going to ask and what the symptoms are. And so if the provider has a marker board, I will actually write our questions up on the board and then put a little bulleted list of some of the symptoms. If they don't, then I actually will bring the piece of paper. I usually bring 2 copies, one that I hand to the medical assistant when they check us in, so they can hand it to the provider so they can look at it before they see us if they want to. And then a copy that I keep for myself in the room so that I have it so I don't forget things. You don't walk out of there and go, oh my gosh, I forgot to ask them if we should do this, and then feel frustrated that you're not going to see him again for 6 months. And now you have to try to do this over the phone or through MyChart. So those can be important pieces to have. And then, being able to advocate for yourself based on severity. So again, knowing when to say, hey, this is a big deal, and knowing when to not. So you don't want to be the person who cries wolf, because if you do, then the provider's office will stop respecting that you have an emergent situation. It's one of the things that I feel very fortunate about is I've been able to build really, really great rapport with my own and my children's providers, so that when I call and say, this is an emergency and we need to be seen as soon as possible, even though when I called 3 weeks ago to make an appointment and there was a 9-month wait, if things get bad enough in between, and you call and I say, hey, this really is a big deal, they often can get us in within a day or 2, or sometimes a week, to see the specialist, because they understand that I only ask if it really, really is important. So being able to advocate based on your severity, translating again, what are the symptoms, what are your concerns, and why is this severe and important? Giving that numeric representation to a pain scale, or tracking your stools and being able to say it, typically I have 2 bowel movements a day, and the last 4 days I've had 7 a day, or typically I have 7 a day and I'm now having 1 every 6 days. It's a really important piece of information. And then lastly, on this communications piece, if you are talking with a person who's scheduling and they are not understanding because they are not a medical person and they're just a scheduler, ask if you can speak to a nurse or utilize MyChart to send in information. So again, if this gatekeeper is saying, oh no, I'm sorry, it's only 9 months, we can't do that. And you said, but I just talked to the provider and they said to schedule a follow-up in 1 month. Nope, the schedule says 9 months is the soonest. You can ask to speak to a nurse, and so the nurse can help you with that process, or you can ask them to even email the provider. I do that a lot. I'll say, hey, I know they want to see us sooner. Can you please email the provider and see if they can open up an appointment, which they often will do, or using MyChart. The other day, we were trying again with the rash to get a kiddo in, and they were having difficulty getting into appointments. So took photographs and sent them in on my chart to the dermatology at the children's hospital. And the dermatologist helped us get an emergent appointment in with the pediatrician locally to get seen more quickly. So knowing how to use my chart, knowing how to communicate, and a lot of people aren't aware that most providers can get back to you much more quickly through my chart than they can when you call and leave a message on the telephone line. So that also was something that I learned from a friend who is a physician. She said, oh, I really appreciate it when people just send me a my chart notice, because I can do that. If a patient's running late, I can look at them and start to answer them, or I can answer them at the end of my day. I sit down and open my chart and do that. My nurse checks my chart throughout the day, and the phone calls are hit and miss because they might call you back and you're in the restroom or you're in a work call and you're not able to take that, versus my chart, that message sits there and waits for you, and they can put much more detailed information than they can on your voicemail. So really knowing how to use my chart to advocate for yourself is important as well. The next thing on this process is learning when to be flexible and when to be rigid. So flexibility really needs to be based off of, again, knowing your symptoms, knowing the severity of your situation, knowing your own personal availability, as well as understanding the availability of the provider. So those three things together, when we have, again, a tough situation where we have important symptoms that are happening, they're pretty severe, then it's my job to make myself as available as humanly possible so that I can get that quicker appointment. When you throw up your own roadblocks and gates, then it really is challenging for them to get you in. And so I often will say, I will go to wherever there is an appointment. So for example, I live in the state of Washington and my children go to Seattle Children's Hospital. And so when I call, I will say, I will go to the Bellevue Clinic, I will go to Everett, I will go to Federal Way, I will go to Seattle. If there happens to be a cancellation in Eastern Washington, if my kiddo is well enough to be able to drive that far, and it's the difference of being seen this week versus in 9 months, absolutely, I will drive to Eastern Washington if I need to. So when you say that you will make yourself available, you'll go to whatever location, you will adjust the time, absolutely, I can take a 6 in the morning appointment if the provider is willing to see me before they normally start their day, or I will take a 6 p.m. appointment, or I'll take a Saturday appointment. Those are all going to be things that help you get in much more quickly when you are trying to get access to a provider. I also put myself always on the cancellation list, but you have to know that you've got to be willing to go. If they call you, every once in a while there'll be a time where you just absolutely can't, but you want to be sure you're the person that they call and you're like, oh, thank you, I'm on my way. Not that they have to call you over and over and every time it's a no. So in that process of, okay, here are my severity, here's my symptoms, here's my availability, I'm going to go anywhere there is, and there still isn't the opportunity to get into somebody as quickly as you would like, then it's time to consider seeing an alternative provider. So that goes back to, why did I talk about the MD, the DO, the nurse practitioner, those different people? Is there a different person you can see? Maybe there's another provider within their office and you usually see Dr. X, but Dr. Y is available. Well, can you see them? Try them out for a first time. They will coordinate with your normal person you see. Or is this a situation where the nurse practitioner can help you? Maybe they can fully do the care all the way through, or they can at least get you started and help translate that information. And then ask your other provider, like your primary care provider, for referral. Ask your specialist for a referral to other specialists. So maybe your IBD doctor, your gastroenterologist identifies that they think you need to see a rheumatologist also because you're starting to show symptoms of arthritis or erythema nodosum, you're getting the large lumps on your body. So they say, hey, we want you to go see this. Ask them to do a referral for you, not just give you a name that you write down and call yourself, but if they will reach out to that provider and advocate for you, or someone on their staff will, for you to be able to be seen sooner. And I can tell you that I know this works because my son's providers have done this, where they wanted us to see another specialist within their hospital system, and that person was really challenging to get into, sometimes over a 12-month wait. And so 3 different of my son's doctors all together sent in an impassioned plea to this provider's office to say, please, would you be willing to see this kid before hours, after hours, during lunch, whatever. And that combination of the 3 providers got us from a 13-month wait to a week. So sometimes providers themselves can really help you move things forward. I just want to speak again real briefly on the wait list to give you an example. My son needed to have a colonoscopy, and again, we were told that it was going to be the end of July. This was last week. And I said, okay, we took the appointment. But then I also said, is there any chance we can get on a wait list for it to be done sooner? They said, absolutely. I got a call on Friday that someone canceled their appointment, and we are going to be getting that appointment next week instead of the end of July. I also had a situation where my kiddos were going to do a sleep study, and it was 4 months out. And I told them, please put me on the wait list. I just need enough notice to be able to drive because there isn't any prep for that type of appointment. So I need 3 hours notice to drive to Seattle. And the next morning they called me and said, someone had canceled that morning. Could I be in Seattle in 3 hours? And I said, I'm on my way. So again, we went from a 3-month wait to 24 hours. So really, if you can, put yourself on the wait list and be willing to drop what you need to drop and go so that you can get access to that care and that you're not a roadblock to your own process. So when it's time to actually get to your appointment, you want to make sure you are prepared for your appointment. There's nothing more frustrating than getting there and having them say, you know, okay, I heard your symptoms. I'm going to need you to get me more information. So I want you to go home and keep a headache log for 6 weeks, or I need you to start tracking your sleep schedule. And when are you going to bed? When are you getting up? What time are you taking your medicines or eating? Is that influencing? Maybe you're having nocturnal stooling where you're waking up in the middle of the night needing to go to the bathroom. That is super frustrating for someone to send you back home after you waited 3, 6, 9 months to see them because they want you to keep a headache log or a stool log, or they want you to record when you're eating versus when you're sleeping. They want you to record your pain and where it's at in your body. So if you are experiencing any of these symptoms, I strongly encourage you to track them for at least a week or 2 before you go to the appointment so that you can hand them the log and have a conversation about real-time data as opposed to having to go home and come back with that. I also will often call ahead like a week or 2 before the appointment and ask, is there any preliminary lab work that they know they want done that I can do in advance of the appointment instead of being told at the appointment I need to do it? Because then again, they have to wait for the results to come back before they can make a treatment recommendation. So it's great to call in and say, is there any lab work you want me to get done ahead so the results are available for our appointment? On the appointment day, you want to make sure that when you talk to the healthcare provider, you present the most severe symptoms first. This happens all the time. I've been guilty of it myself, where you've got a whole bunch of things you want to talk about. You've waited forever to see this person. You've got a laundry list. And so you start with what might feel the most frustrating to you at that moment. Maybe you woke up with a rash and you know it's itching and it's frustrating and it's somewhere that is visible. And so you want to talk about that because you're really worried about it, but you've actually been having, you know, symptoms of a flare for 6 months. But right now it's calmed down a little and it's not as emergent. And at this very moment, your stomach doesn't hurt as bad as the rash does. So you focus on the rash. You really do want to figure out why you're there. And on your list on your piece of paper, have what are your most severe symptoms in order so that they can focus in on why you're there. I can't tell you how many providers I've had say, you know, I see a patient in office and they talk about, you know, the different things they're experiencing. Maybe they have pain in their lower leg or they've got some, you know, lower left quadrant pain. And then on my way out the door, they also say, oh, by the way, my heart has been racing and I've been passing out for 3 weeks, which is an emergent situation. They said the appointment's basically over. They have to go to another appointment. So at that moment, they have to often just refer them to the ER as opposed to being able to have talked about that during clinic. And if it was appropriate or if they should have, you know, gone to the ED immediately. But you want to give them that information up front so they can really try to help you. What is the most severe thing you are experiencing with? And then again, adding that numeric scale to it on a 0 to 10, this is what I'm feeling, and this is where I'm normally at. Maybe you're a person who lives in chronic pain, so you're always a 3. And so you want to let them know that I always have at least a level 3 chronic pain that I deal with every single day. But right now it's a 9 and I'm incapacitated. That is important to know. Know your goals going into the appointment. What do you want to come out of this? Are you hoping to get blood work done? Are you hoping to update some imaging and scans? You feel like it's been a while, you feel like there's things going on and you want to ask about that. Is your goal to get some support on the diet? Or are you hoping to come out of this appointment with a referral to a dietitian or a referral to maybe a social worker to help you with the psychosocial components? To maybe you're struggling with components of the diet and so you're having difficulty following part of it. Maybe you need support in that area. What's your goal for this appointment? What do you want to get out of it? And then also know your own capabilities. You want to be sure that whatever you agree to in the appointment, you're actually going to be able to do. I don't even know how to describe how frustrating it is to really feel like you get someone a great treatment plan. You worked with the provider, you worked with what you heard they said. Everybody's in agreement that this is what you're going to do when you go home. But then in reality, you are not capable of it. Maybe it's that you're going to be purchasing some supplements and financially you can't do it because you have to get them from certain places for them to be SCD compliant. And so that's really important to you, but it makes them way more expensive. And so ultimately you can't afford it. And so you only take half of them, or you take them every 5th day instead of every day as they're supposed to be taken. That's not going to help you get to that successful goal. Or maybe it's that you need to do a certain amount of exercise and you don't have the time, or it's not safe where you live to go outside and then at night in the dark, and your apartment complex is too small to be able to do the type of exercise they're asking you to do in that space. So you have to let them know so they can find an alternative. I helped someone recently who was facing that very situation. They lived in New York City in a little teeny tiny apartment, and their provider was asking them to start doing exercise that was going to really raise their heart rate. They didn't feel safe going outside. They also didn't have the money or the room to buy some big treadmill or bike or things for their unit. And so we found them under the desk bicycle that was literally almost the size of a laptop computer. It was a little over $100 that you sit in your normal chair and you put your feet in these pedals and you can pedal sitting at your desk. And so they were, obviously it's not the same as riding a bike outdoors or riding one of those really fancy fitness bikes, but they were able to get the type of exercise they need and get their heart rate where they needed it to be successfully within the parameters of their budget and the confined space of where they were living. So it was finding a solution for their capabilities based on what was being asked. But I mean, my own family has been guilty of this. I say to my teenagers all the time, don't say you're going to do this if the doctor says, use this cream or take this medicine and it's multiple times a day. Don't say you're going to do it if you're not actually going to do it, because they're sending you home thinking they've got you on a pathway for success. And in reality, you're going to continue to feel worse because you're not going to execute what they asked. So really know what you're going to do and then voice that out loud. If you don't think you can do it, then say to them, I don't think I can do that. What other alternatives are there, or what supports are there so I can be successful at that? And then finally, on appointment day, make sure you bring with you your charts and records, whether that be the tracking that you've done yourself, or that's a record from a different healthcare provider. Maybe you want to bring in your vaccination records. It's someone who's new that you've just seen, so you've done recent vaccinations. Maybe you did the shingles or you did the COVID vaccines or whatever you did, bringing that information in with you, bringing in information from other providers you've seen. Because one of the things people don't realize is unless your providers are all within the same system and they're all on the same electronic medical record, they might not know what someone else has done, especially if you're seeing a traditional MD and a naturopathic provider. They often won't have access to each other's records. And so they won't know what the other person has recommended. They might not know what other medicines you're taking. So as part of your charts and records, I also say that includes your medications. I honestly encourage you to either take a photo of the actual label on the bottle or just bring a Ziploc bag of your medicines along. That way, and that includes supplements, that way they can ask, what's the dosing on this? How much of it are you taking? Is it 10 milligrams or 20 milligrams? Are you supposed to take it once a day or twice a day? Do you take it with or without food? There are different medicines that, depending on the circumstances, the providers will recommend you take a different way. And it really is important to know what that pathway was for someone else, to see, will these medicines interact with each other? Gosh, if this person is having you take this in the morning, then I want you to take this one at night. So you want to make sure you give them all that information. And when you get to an appointment, it can be really hard to remember all the medications you're taking, all the supplements you're taking, the dosing of them, what time of day, how much. So just write it down, take a photo, or just bring the actual bag. Some examination tips, things to make things go more smoothly for you. If you have the time to wait, ask for the first appointment of the day or the first one after lunch. The provider is the least likely to be running behind if you take one of those. So if you have a time-sensitive situation, try to request those appointments. Now, I do like to always throw out the caveat to people. Healthcare providers can run sometimes 30 minutes, an hour or more behind schedule. If you have an issue with time, state that when you arrive. If it's a true, honest issue, not just a like to have, I want to be out of here quickly, but I have to be back at work. I don't have a choice, and I have to be back within an hour. When you check in, ask, are they running behind schedule today? Because I have a critical appointment that I have to be back at for work, or I have a follow-up appointment with another provider. We do this where we try to stack appointments when we drive to the children's hospital. So we might have 3 or 4 of them in a day. So if there's a timing issue, you want to let them know at check-in, because sometimes they'll say, oh, this doctor is an hour and a half behind schedule. Why don't you try to go to your next appointment first and come back, and we'll see you at the end of the day. So, but I wouldn't have known that if I hadn't communicated and asked those questions. So find out where they're at in their schedule. And if you don't have the time to wait, let them know where you're at. And if it's going to be longer than you have open, then ask to reschedule that appointment for either later that day or another day, because it's not going to work with your situation, as opposed to sitting there getting angry and frustrated and then walking out in a situation where you've created tension between yourself and the provider because you waited too long and now you're angry. It is okay to say, I need to leave. That's not going to work. I can't wait for the 2 or 3 hours. However, I would say to that, if you can wait, I really encourage you to be a person who shows grace, because I'm guessing that many people who are participating in this video are people who they themselves have been on the other side of that, and they've been the emergent appointment that the doctor shoved into their lunchtime or before or after hours, or that was a 5-minute appointment slot available, but you actually needed more like a 45-minute appointment based on how severe things were. And so if you've ever been on the receiving end where you were the person who got that extra care that didn't actually fit in the daily schedule, just try to remember when a healthcare provider is running really, really late, that could be you sometime, and that person really needed their attention at that time. It will immediately diffuse a situation. When providers come into the room and they're 30, 45, an hour or more late, they come in tense because they expect you to immediately be angry and frustrated with them, that you're going to be like, I waited forever and I need this and I have to get back to work. And so if you have the ability to have that grace, and when they walk in and they immediately say, I'm so sorry we're running late, if you can say to them, it's okay. I was able to wait today, and I know that somebody else needed you more than I did at that moment. So I'm so glad you were able to help them. You will watch the tension just relax in this provider's body, and then they're not going to rush through your appointment. They're going to give you the time that you need as well, as opposed to trying to catch up that time because they just want out of there because they're worried you're going to be angry with them. So that helps build that rapport, that give and take between yourself and your provider. Request that the provider engage with the person. So this is an important examination tip. This photo up here, I have a picture of a doctor giving a checkup to a teddy bear. If you are ever working with children and you're trying to get care for your own children or helping someone else get care for theirs, ask that they meet that kiddo at their level. So I used to bring in a stuffed animal. My son had a giant plastic dinosaur he'd bring to his appointments. And I'd ask the provider, like, before you're going to do whatever you're going to do to my kid, please do it to this. And so, listening to it, sticking the ultrasound wand on it, pretending to even give a vaccination and put a Band-Aid on it. all of those different steps, if they can get them to take an extra minute or two to do that, can really be a huge help to reduce anxiety and set a clear expectation for a child. You have to think, when a kid goes into an appointment, it's a foreign environment. There's lots of noises and smells and devices around them. So automatically they're fearful. So if you can get that provider to come down to their level, engage with them, engage with something that doesn't have to do with them, maybe it's a toy or a stuffed animal, that can really help. If they don't have something available like that, even asking the provider, would you put the blood pressure cuff on me? Would you rub that alcohol wipe on me so that they can see, or let the little kid do it to either their parent or to the provider's hand? Sometimes that can really bridge that gap where they're not as afraid. Same thing if you're working with someone who's older and they don't understand the technology that's being shared, or they're fearful of the situation. In a similar process, you want to ask them to come to their level and help them explain. Slow down the language, health literacy. Most of us don't speak doctor speak. And so you need someone to translate that complex information. So ask them to say, instead of, you need to be NPO for 24 hours. A lot of people don't know what that means. Oh, that means you can't eat or drink, right? I want you to check into my chart and send me your information. Again, sometimes people don't understand what a my chart is. You have to explain, well, this is what that is, and this is how we do that. So ask that the provider in advance, maybe it's a note that you hand to them before they come in to see, maybe it's your parent that you're advocating for and you're there, that they understand. You give the provider a little note that says, mom has been experiencing some dementia symptoms, has been losing items, but does not want to talk about the possibility of memory loss, and doesn't understand a lot of technology things. So you need to talk to her about things on pieces of paper as opposed to finding them on the internet. Giving them that advance warning can really help them have a better appointment with you. Also, during your exam, ask lots of great questions. When they're recommending a new treatment, make sure you identify any possible side effects. Always say, what are the side effects of this medicine? Is it going to interact with any other medicine that I'm already taking? Ask about treatment alternatives. Are there all natural things I can do instead? Can I, eat more broccoli? Can I exercise more? Can I adjust the time of day? Maybe I need to look at intermittent fasting. Maybe I need to look at not eating broccoli. Are there different ways that we can get at this same approach? Instead of taking a vitamin D supplement, is there a way that I could try the vitamin D light? Are there different things like that I can do? Non-pharmaceutical and lifestyle interventions. And then also, again, being really honest about the financial and time impacts of their recommended treatment. So what does that look like? If you said you want me to do a vitamin D shot, how often do I have to do that? Is it going to be one of those really easy to do plungers where I just, put it directly onto my leg and push the button? Or is it going to be a more traditional shot where I have to press and do, the actual pull the skin up, that sort of process? So what is that going to look like, and how am I going to be involved in this? So next steps, express your concerns and your limitations at the doctor's office when they're doing the exam. And we're talking about, again, next steps, you're heading home. Here, one more time, I just want to say, this is what I'm worried about. This is what I have that I can do. This is what I don't know if I can do. Is there a support that I can have? Is there a video I can watch? Is there a training I can, how about a book, a handout, a website, a podcast? How can I get more information so I can be better equipped to do this? Also, always ask when you should be seen next. So every appointment you should, at the end, if they don't say, when would you like to see me again? And I also follow that with, if I have emergent symptoms that would require me to contact you sooner, what would those look like? Because sometimes they'll say, oh, unless you're, having extreme pain or tons of new bowel movements, you should be fine to see me in X amount of time. But it may be a situation where they're switching your medications or they're following something closely, and they'll say, actually, if you start to have more than 3 bowel movements a day, go ahead and call in and we'll see you sooner, as opposed to, oh, you're fine. But if something changes, go to the emergency room instead of calling me. So figuring out when should you be seen next, and what is warranted for calling them for a sooner appointment versus I need to not pass go and just go to the ER versus maybe I can just go to my primary care and they can help manage the symptom. And then ask how you schedule a follow-up. Sometimes there's going to be a situation where you have to call in. Some places prefer that you're walking out the door, you walk up to the desk and schedule that follow-up. So ask which is the best or most preferred process, because if I don't know if you experienced this lately, but the other day I spent 55 minutes on hold trying to schedule an appointment that I really wished I could have done in person when I had been there and scheduled it for a follow-up. So if you have the possibility to schedule your follow-up before they leave their office, I would recommend that as opposed to having to phone it in. And then make sure you summarize what you think they've just recommended. So you might say something like, so what I heard today is that I'm supposed to start taking a vitamin D supplement, making sure I'm drinking 2 more full glasses of water a day, and trying to keep my bedtime consistent each day, and then really limiting how many cruciferous vegetables I eat in the afternoon. So not very much broccoli or Brussels sprouts or cauliflower past 12 o'clock, and see if that helps my gas and bloating. And then I'm supposed to send a MyChart notice to you guys in 4 weeks and update you on how that's going. Is that correct? And so you've just parroted back to them everything that they told you, and that gives them the opportunity to correct this. This is a technique that's used a lot in counseling, and it helps the counselor make sure they understand what you're saying. We'll use this. It's called a motivational interviewing technique. Repeat back to them what you think they just told you so that you can make sure you truthfully understood and they can correct any issues. And then again, finally, ask for resources that you can refer to after the appointment. Is there a handout? Is there a website? Is there a book that you can read? Is there a podcast, a video? Is there another provider you can access? Again, is that maybe going to see the dietitian? And then finally, in this situation, know your rights. Make sure you always read before you sign. What is the recommendation, and do you actually have to do this? Do you need to do this? Is it critical you do it? And what are the implications of it? So read all the information and ask good questions before you sign things. It's okay to ask for a second opinion or to completely switch to a new provider. Again, if you are following the diet and your provider absolutely and unequivocally does not recognize or appreciate the diet and is not willing to consider the diet as a treatment path, then you might need to find a provider who is going to be supportive of that route, so that you don't have every appointment be confrontational and them arguing, you need to do this, and you're saying, but this is really giving me great success. That's not a good match. And so that's the time to find a second opinion or a new provider. And then match your goals with the best fit provider. So again, remember before we talked about someone who's an MD, a DO, a functional medicine, a conventional medicine, or a nurse practitioner who is the bridge between those. Figure out what the problem is right now, how emergent it is, and what type of support you want in that. And then pick a provider accordingly, if you can, to help you do that. So really ask, call in, I just need to be seen quickly. Is there a nurse practitioner who works in this clinic who can support me? Because I know Dr. So-and-so is booking out a long ways. You just advocated for yourself by stating up front, this is what's happening, this is what I need, this is who I'm willing to see. And then again, always asking for additional treatment options. Just because they present you with medication A does not mean that that's the only option. So ask for those additional treatment options and be honest about your ability to follow through on those. So the last thing I want to say to you all is, as a caregiver and a patient myself, one of the most important things to know is that you have to take care of yourself so you have the health and energy to care for those you love. And I am guilty of this myself. When my kids are having a lot of health problems, it's really easy to cancel my appointments, let my things slide. And ultimately that is not what's going to be for the best for you or for them. And so part of advocating for the health care of your loved one is also advocating for the time and energy to take care of yourself as well. So with that, I'm going to open it up to questions.
Thank you so much for all your presentation. It was outstanding. You covered so much. One question that came up is, ombudsman or ombudsperson, have you had experience, or do you suggest reaching out to the facility or the state ombudsman to provide any type of support to navigate the system?
I have not worked with those folks, so I do not have any personal experience with that to be able to answer that. I typically do most of my own navigation work and do that on other people's behalf. So I've worked, with social workers a lot and nurses to connect the dots, but I have not worked with that group.
Okay. The other one that came up was the doctor's office doesn't want to give me my medical records. What do I do?
So sometimes there are situations when you have to use a little bit more forceful language to get what you need. And so those are your records, and legally you have a right to those. And so they do not have to print them for you because that can be expensive. They do have to provide them to you electronically. Now, sometimes they want an actual provider and route for them to go to. So it might be that you have to connect them with the fax number or email of another provider's office. So you're switching provider to provider. And if you feel like part of the tension is you're leaving one GI doctor to go to a new GI doctor, have them sent to your primary care physician. And don't bring up sending them to the new specialist, send them to the PCP and that they have them there. But you have a legal right to access your records. And if you want them yourself on paper or on like a CD or a thumb drive, they may charge you for that, but you can make that happen. And sometimes it is going to be having to be a little more forceful and saying, I know it's my legal right to have access. Those are my medical records. And so here's my expectation. Those need to be sent to, and give them who they're going to. And if you can't comply with that, then I'm going to need to speak to the medical director of this facility. Who is that? And, that's usually where sometimes they'll go, red flag. So they'll go ahead and comply. But I had this, it took me 3 years to get my records from one provider for myself. And I had to send paperwork again and again and again. And I ultimately had to threaten that I was going to contact an attorney. And then they magically released them. Right. So know that you can do that. And the same goes for advocating on behalf of a loved one getting care. If they're in a facility and they're not being released to a different facility, you may need to go that same route. It's the same actually as records. I had to do this. I helped 2 different people during COVID with this, where their loved one was not getting the care they felt they needed in the tiny hospital in the town they were, and they wanted them to go to a bigger facility, and the little hospital wouldn't release them. And so same thing, they wouldn't release a person instead of records. And so they had to get pretty forceful and then ultimately threaten legal action. And that is unfortunately the ultimate path that you sometimes have to go to, but it is an option.
One of the things that you bring up, which is just so important, that I hope everyone understands and takes advantage of, is they only see one doctor or one specialist, and they don't create a medical team for themselves, such as a primary care doctor or a pediatrician or a hematologist or a gynecologist. They get so siloed, and they think that this one particular practitioner who says, oh, I'll take care of it, may not necessarily have any expertise in it.
Correct.
And one of the cliches that come up with is, if you only have one set of eyes looking at you, you may not have the complete story or picture of what's going on. And so to use an entire medical team as much as possible would give you much more advantage than having one person with their particular expertise or knowledge or outlook to be able to provide you some more information. So
that's very well said. And it's so true. One of the things that I love, my son's gastroenterologist, he said to us one day, my son asked about some other symptoms that were tied to the whole autoimmune pathway. And his response was, bless his heart, Dr. Suskin, we are going to connect you to, your specialist. We're going to get you a specialist that deals with that, because that's not what I studied in medical school. Yes, I learned a little bit of that, but I know a whole bunch about this pathway, but there's somebody else like me who knows a whole bunch about that. And I'll never forget that conversation with Dr. Suskind. And, he did such a great job of saying, I can help you a little bit, but let's get you an amazing person who can really dig deep and help figure that out. So yeah, really critical to make sure you have all the members of that care team. And the other thing I will throw in there real fast with that is when you're building a care team, there's different personalities of providers. And so you have some who are the really like warm and fuzzy, and I'm going to ask about your life, and I'm going to hold your hand, and I'm going to create this really strong rapport. And then there's others who barely make eye contact, who are icicles, but they're brilliant. And there are times when you need that warm, fuzzy person who's going to help walk you through it. And there are times when you want the smartest human being on the planet. And it's okay that their bedside manner is not the best, because you need the other skills they have, and someone else can wrap around and do the other parts. So you don't ever want your primary care physician to be the iceberg. You want them to welcome you and, accept you and all those things. But, we've had some specialists, my son has, where he's been like, whew, that person had no bedside manner, but they were so smart and so capable of connecting all of the dots to getting us to where we needed, that it was a profound experience and still worth it. But if you have someone who's just an iceberg and not listening to you and not connecting those dots, then that's a nightmare. So that's the other piece to add in there.
It's absolutely true. I mean, you're finding someone who is going to save your life. You're finding someone who is the scientist who's going to take your issues and turn them into something that is a plan of action to make you better. And not all personalities get along, and that's okay. But as you said, identify the personality set and know their strengths and weaknesses in being able to use them to your advantage, but understand that there may be some disadvantages as well, like not having the best bedside manner. My mother did the same thing, where she had a surgeon save her life, and she wanted to hug him, and he said, "Oh, no, I don't get hugged. But finally, I guess after a few years, she got one in, and but he raised his hands, but he saved her life, and that was the most important thing to her, so. How would you go about asking a practitioner questions about your condition that may make them feel like you're challenging them? For example, a GI was trying to explore the possibility of dysmotility and started talking about a function, migrating motor complex. And the doctor didn't take it so seriously. And it was very challenging of their own expertise, and they weren't comfortable with it. And they really didn't want to discuss things any further. How do you deal with that when someone says, for example, you're the worst case I've ever seen in my life, I don't know what we're going to do? Or a doctor that just feels overwhelmed with what's at the table and doesn't know how to say, maybe I should put you in contact with my colleague. So how do you deal with those personalities that may not be so accepting of the challenge, or may take on more challenge than they're comfortable with?
Yeah. So, one of the first things that I always bring into this is how you present yourself and your tone. And so one of the big parts of building this relationship and reciprocity with your providers is thinking of it as yourself as part of the caregiving team. You're an expert on you, and they're an expert on what they do. But without your information, they can't do their job well, right? You're just a vessel, and they can only look at what they can see on the outside or what a little number says to them. But you are the expert on you. And so making sure you go into that appointment with that knowledge, so you don't feel like, okay, maybe I'm getting dismissed and I'm crazy and I should stop talking about this. Nope, you need to, hold true to that expert on you. So that's where the idea of the, keeping records and coming in with that chart of, here's what I'm experiencing. Here's the 2-week bowel movement record, and here's what I've been doing. Here's the medications I'm taking, the amount of fluid I'm taking in, here's what I've been eating, and here's what's happening. It's really hard to ignore data. If you're a data-driven doctor, then when you present them with data, it's very different than words. I feel this, I'm experiencing this. Some doctors need the data. They don't want to hear the touchy-feely, I feel this, because they don't all look at you as an expert. Not all doctors see that. Some are amazing and see that, and others are like, no, these people don't know what they're talking about. And that's because too often they have patients who don't give them accurate information. And so they don't feel that connection that way. So coming in with this data about yourself, coming in with, I bring in sometimes research articles from the internet or a printout. Let's say maybe Cleveland Clinic has a functional medicine blog that's written about this very thing. I bring it in and say, I read this and I think I'm experiencing this. I want to talk to you about this. If you don't do it, who does? And so, asking that again, if this isn't something that you're able to do, who else does? And if they still won't help you, I've seen this, that they barely glanced at the research. So if they won't look at it and they won't talk to you about it, then maybe it's time to consider that you need to find a different provider. And the beautiful thing in this world of telemedicine is more and more doctors around the country are actually getting licensed in multiple states and are able to see people like this on telemed from afar. And so it is possible now to access different additional specialists. But yeah, so that you wanted to handle it better in the moment. I think the big thing is, in the moment, I really try to make sure I check my energy. That's been the biggest thing that I've found where doctors have been willing to work with me. I mean, I was on the phone one night with the head at UW Medical Center of the the pulmonology clinic, trying to get help for my mom. And he and I were talking on the telephone back and forth on a Saturday night, because I called in and asked to speak to the attending on call. He called me back and forth. And, he said to me afterwards the next day, he's like, you were lovely to talk to because you were in a panic situation, but you didn't take that panic out on me, And so making sure you bring yourself to a calm space where you're not showing your agitation, because that makes doctors, I'm sure they've gotten yelled at so many times, it puts them in a PTSD spot. But then, for the person who's saying that they weren't hearing them and they weren't seeing that I think recognizing the line where you've presented it a couple of different ways. Here's the research. Okay, they won't look at it. Here's my logs. Okay, they still won't look at it. Here's my words of me talking about it. They still don't want to talk about it. Then to me, that's the point where I've tried 3. I do 3 strikes, you're out. Is there someone else I can talk to about this? Do you have someone else you can refer me to? And if they don't, they still are like, no, then I would leave and start looking on my own.
You bring up excellent points. I share, for people to be empowered, to not feel that they are fearful of what's going on, because part of being fearful is not being educated. And to become an informed, educated consumer is so important. And as you clearly state, it's so important to know your information, because it's so easy to go in and say, okay, doctor, fix me. And they're more than happy to check you out within 15 minutes with whatever schedule they choose or algorithm they remember, than to be able to explore the root cause. And one thing that our insurance companies, or maybe even some of our medical community, they don't always get to the root cause. It's always, let's deal with symptom control, which is supposed to be something helpful, but symptom control could be symptom control for my next 80 years of my life. And that's not where I want to be. I'd rather spend some time with you to look at the root cause and get to the details as far as we can go. And let's get to the core instead of just treating the symptoms, because even though the symptoms go away, it doesn't mean that the root cause went away. And how long is that going to last? And so one of the things that I always find helpful as well, Dr. Hardy, is to share that even with children, you have 80 years of life or 90 years life ahead. And we're not, although we need something to take care of the moment, we still have to look at what it's like for our future and the effects that what we're doing today may affect the future.
That's so, so key. It really is so important. And, you know, another piece to that is asking about genetic testing. So that's that scary quagmire that a lot of people don't want to talk about. Like it's one thing to say, do I want to know my risk for Alzheimer's disease or not? And I'm 35 years old, right? It's another thing to be in the throes of inflammatory bowel disease and then developing additional autoimmune conditions. And you're already living it. You're there. It's not a future do I or don't I. You're in the mix of it. So do you want to find out if there's a genetic proponent that is connecting these different diseases? And if so, I will let people know it changes the way that your treatments are done sometimes. If there's a genetic underlying cause, some of the medications that are commonly used, let's say to treat inflammatory bowel disease, they might change their minds on because they're like, ooh, now that we know that this is the actual root underlying cause, we are just masking symptoms as opposed to treating what's going on. So it's really critical. And then understanding the long-term side effects of the medications you're on. So it sounds lovely that if you give me this at this age, it can make it stop. But what is the possible future implications for that? Is there going to be a fertility issue? You know, that's something that I've trained my teenagers to ask. Is this going to impact my ability to have children in the future, possibly? You know, are there different things that I'm not thinking about? Is this going to counteract one of my other medicines and not make it as successful? Like, it's not going to completely negate it, but is it going to make my headache medicine not work as well? Is it going to make, you know, something else have a new problem? Am I going to develop other symptoms because of this?
I so appreciate your time. On behalf of the Specific Carbohydrate Diet Association and the community, I want to thank you so much for all of the time that you've given. You are truly a passionate warrior, and I wish you and your family all the best.
Thank you so much. And thank you everyone for joining today. And just remember to use your voice and help yourself and your family get the best care that you can.
Thank you.
Thank you. Talk to you later.